So if for some reason you've been waiting to get vaccinated, make sure that you get vaccinated this weekend immediately to get yourself protected first and foremost. And really everybody who gets vaccinated is a winner. But if you've been putting it off, here's a good reason to do it. You could be the next $1 million winner. We'll also be giving 5 more young Coloradans a $50,000 scholarship, and there's 10 more to give away for anybody aged 12 to 17. So again, if you're 12 to 17, get vaccinated this weekend. They were all surprised it was them, and it could be you who is the next $50,000 scholarship winner. Colorado is in a mad dash to achieve President Biden's goal of 70% of those age 18 and up vaccinated by the 4th of July. We're very close. We're very, very close, over 69%. And hopefully we can finish it out strong this weekend and get over 70% by July 4th and be one of the states that achieves that goal. And then we move forward from there. And we are not close to 70% for the 12 to 17. We continue to want to focus on them, as well as additionally folks over 18, and making sure everybody who gets their first vaccine also gets their second vaccine. And I want to thank all the vaccine providers in the state, community organizations, community health clinics, Children's, Kaiser, CU Health, so many that have stepped up and are administering the vaccine, working with the state. Our large sites, our pop-up clinics, the vaccine equity team, and especially those, including pediatricians, that are now administering Pfizer to those age 12 and up. And a lot of kids 12 and up might be visiting their pediatrician for their annual checkup over summer and are hopefully getting vaccinated there if they didn't have the chance to earlier. Now, I'd like to welcome our $50,000 winners up, Clara, Bay, Liza, Sula, and Nathan. And the $50,000 goes in a college invest account. It does accumulate interest. It can be invested and it can grow over time. That's particularly important for some of our 12 and 13-year-old winners. It's more like a $65,000 or even $70,000 scholarship. And it's usable for a wide variety, really any kind of future education need that's allowable under this. First, we want to introduce Clara. Clara loves drawing. She's quite the artist. She also loves traveling. She got the vaccine to protect her family, especially her mom, who's a retired nurse, and her dad, Jason, who's also joining us. Clara, I know the virus impacted your family's lives early on. How will being vaccinated help you see loved ones that live out of state? And do you have plans to visit any schools this year to see where you might be able to use this $50,000?
I feel like being vaccinated will definitely make it easier to see my family out of state, but more importantly, I can see them while keeping them and others safe, and I'm very grateful for that. I am actually planning to visit Fort Lewis College in Durango this upcoming month, but now that I will be receiving this large amount of money, I am super motivated and excited to expand my search for colleges this summer.
And as I mentioned to Clara earlier, she will not find a college more beautiful than Fort Lewis College in Durango, the most beautiful campus in the entire country. And who knows, maybe if you do wind up going there, you can use some of this money for grad school, if you choose to go to grad school too. There's a lot of other uses besides your undergraduate degree. Next, we have Bay from Boulder. Bay was still holding his breath after finding out from his mom, Nicole, who's watching on the live stream today. Hi, Nicole. That he won a scholarship out of the blue. Bay landed a highly coveted summer job at Eldora and will be going even further to reach his goals as an inspiring automotive mechanic or electrician now that he's safely vaccinated. Bay, what were you able to do after getting vaccinated, and how will this $50,000 help you drive your future forward?
So I'm finally able to go and visit my grandma and loved ones that I haven't been able to see in a very long time. And with this massive opportunity, I'll finally be just free of all the financial hardships that was keeping me away from just wanting to do what I loved. And that's it.
Thank you, Bay. Congratulations. Now I'd like to introduce our youngest winner to date. As you know, the Pfizer vaccine is approved for everybody 12 and up. For those anxious parents who want it for their younger kids, it is in trials. I'm one of those. I have a 9-year-old and a 6-year-old, and I can't wait till it's approved. Those trials are occurring, but it's been approved for everybody age 12 and up as safe and effective. And our youngest winner to date is 12 years old, Liza from Denver. Liza's parents call her a soccer junkie, and she was surprised to see both of them show up to pick her up from soccer camp and share the news that she had won the scholarship, but they made her wait until they got home. I could only imagine how suspenseful that car ride must have been for Amy and Brandon, her parents. Liza also has a great love of learning languages. She studies Mandarin at school. I love languages too. I speak German and Spanish, but Mandarin is much harder for English language speakers, so we applaud Liza for her efforts to learn one of the most widely spoken and important languages in the world. And at 12, she's already considering a career in global business when she grows up, maybe being an executive at Adidas, advocating for equal pay for women in professional sports and soccer, and I'm right there with you, Liza. She enjoys hiking and camping with friends. Liza, what was your reaction when your parents told you? And can you tell us your dream job now that there's a $50,000 scholarship? And for you, being 12, that'll probably be $60,000 to $70,000 because it gets to be invested along the way. And what will that help make a reality for you?
At first, I was super shocked and surprised, but once the news sank in, I felt very thankful and grateful. This is an amazing opportunity. My dream job is to be a professional soccer player, but I definitely want to go to college to play soccer and to study international business.
Great job, Liza. And hopefully now you won't have to choose between success on the soccer field and the success in the international business arena. You can do both. We have another young winner with a bright future ahead of her, 13-year-old Sula. Now, Sula is taking a quick break away from sleepover camp to be with us. I think it's more than worth it to win $50,000. She found out at sleepaway camp that she won through an email, and I want to thank her mom, Danielle, for driving Sula from camp and being here for this special day. When Sula and her family were living in Spain, she learned Catalan and Spanish to make new friends. And experiencing this virus over the last year back at home in Colorado, it was hard because the opportunity to spend time with friends and family and travel was very limited. So Sula was very, quote, psyched to get vaccinated so she could have sleepovers with friends and safely do things she loves like dancing and karate. Sula, what would you say to others your age about the benefits of getting vaccinated? And I know you're just 13, but is there any particular field of study that your scholarship can help you pursue down the line?
I would say that getting vaccinated for kids my age is really important to be able to do things with your friends and be able to spend time with everybody you want to. I think it's also important to be able to get vaccinated so you can not be giving risks to people who are more vulnerable to the COVID. I'm excited to be able to go to a college where I can learn astrobiology or go to med school. And I'm also really interested in science and yeah.
Thank you, Sula. And the benefits of the vaccine for young people are so many. Field trips, there's so many great opportunities when you're vaccinated. And I want to thank Sula and all of you who joined us today from really being those ambassadors to help get your friends in the 12 to 17-year-old age group safely vaccinated. Our final winner today is 15-year-old Nathan from Boulder. And Nathan said he didn't mind if I shared this, but he was on the way to the bathroom and looked down at his phone when he got the text from his mom, Rachel. And when she came home and broke the news, he was very surprised. He had heard there was a scholarship for those 18 and up. He was heard that there was a prize for people 18 and up. There's $1 million prize, but he had not heard about the $50,000 scholarship for 12 to 17-year-olds. Nathan studies economics, runs track and cross country, and he's going places. Nathan, what do you have to say about the odds of getting this scholarship and the opportunities you have to travel and do the things you love now that you're safe, now that you're vaccinated?
Yeah, it's just super weird. I was having such a regular day, and I was going to the bathroom when I got the news, And at first you think it's a scam. I didn't really believe her, but as time went on, it just seemed more and more legit. What's great about these scholarships for minors is that we're just too young to really comprehend how big of an opportunity this is, and just how lucky we are in general. I'm really happy that I got vaccinated, because now I'm going to be able to visit more families, or families and friends. And I'm just really blessed by the whole situation.
And I just want to reiterate what Nathan said about us being lucky. We're all just so lucky to be Americans and have access to this vaccine. There's people all over the world dying from this virus. There are far less effective vaccines, like the Chinese vaccine, that's less than half as effective as this one. And it's particularly pronounced now. There was a study that came out yesterday. Over 99% of the people dying from this virus are unvaccinated. It's really unnecessary loss. It was sad enough when we recognized the loss early on of over 6,600 of our fellow Coloradans. And there are people, sadly, dying every day from this virus here, across the country, across the world. But at this point, in Colorado and America, in many ways, it's even a sadder form of loss, because it's so simple to prevent. It's so simple. It takes 15, 20 minutes of your time, and you can be protected from this virus. Even those who get vaccinated who contract it have much more minor cases of the virus. And that's why nearly every fatality is somebody who, for whatever reason, has remained unvaccinated and is still at great risk to this virus. So I want to thank our winners. I'm going to present your checks. Congratulations. 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 And as you said, you can't cash these checks, but they make good decorations on your college dorm room for sure, and it'll be a good story to share with your new friends in college or vocational school, and congratulations to all of you. Okay, now for the main event. We have a $1 million winner for the Comeback Cash prize drawing. I want to remind folks the final winner will be announced July 7th. So there's an extra reason for you to go out, get vaccinated, do it this weekend, get it done. It makes, first and foremost, you'll be a winner no matter what, because it all but eliminates your chance of hospitalization or death from the virus. But yes, you could also win $1 million. And I want to announce that today's Comeback Cash drawing winner is Stephanie Sharp from Douglas County. Like so many of us, she was excited to get vaccinated. She's been able to travel, and this is very special, and I guarantee everybody, this was not prearranged. This was just a coincidence. She is literally, now that she's vaccinated, for the first time visiting her father in rural Pennsylvania. So she's joining us virtually today from rural Pennsylvania. She's joining us with her dad, Harry, her husband, Craig, her son, Isaac, her sister, Melissa, brother-in-law, Matt, and her sister and brother-in-law's kids, Jack, Vera, and Ruby. Hello, everybody. And I think Patricia is Stephanie's mom is watching this virtually. Before I turn it over to Stephanie, I want to share a little bit of her story. She moved to Douglas County from a small town in Pennsylvania in 2004. And her number one priority as a loving mother and wife and child psychologist and part-time provider at Children's Hospital supporting kids with disabilities is protecting her family and her community. Her husband, Craig, is a nurse at Veterans Hospital at Fitzsimmons and has served on the front lines during this pandemic, and we thank you for that, Craig. On top of that, while both parents were working in healthcare, their son Isaac started kindergarten remotely this year, which came with its own set of challenges. But through it all, they were able to find levity in humorous moments like helping Isaac fit puzzle pieces together with instructions given by a remote teacher that they themselves were having trouble understanding. The safety piece was finally resolved when both Stephanie and her husband got vaccinated as soon as they had access. And as healthcare workers, they were able to get vaccinated in January. And because of the vaccine, they're now able to reunite safely with Stephanie's father, Harry, for the first time since the pandemic started. Stephanie, we are so humbled to join you for this reunion and to celebrate. And I'm going to present your $1 million prize, and then we'll turn it over to you. Ta-da! And once again, Stephanie, you'll get a much smaller check to go deposit, but this will make a good souvenir discussion piece for future years. And with that, we'll turn it over to you.
Hi, everyone. I'm Stephanie Sharp, and I have been in complete and utter shock since Wednesday after learning that I'm the 4th winner of the Comeback Colorado sweepstakes. As Governor Polis said, I'm out of state visiting my family, who you see in the background. Though I'm originally from a tiny map dot called Forest City, Pennsylvania, I've lived in Colorado now for over 15 years. I'm a mom to my 6-year-old son, Isaac, who's a proud Colorado native, and wife to Craig, who's a nurse at the VA. I'm a child psychologist. I own a small private practice, and I also work at the Children's Hospital of Colorado in the Department of Rehab. I'm passionate about supporting individuals with disabilities and their families. And I believe that compassion and tolerance can change our world for the better. The darkest side of this virus's impact felt ever present at times for us, with my husband on the front lines working as a nurse in the intensive care unit for most of the pandemic. It's been over a year since I've been able to visit my dad, who's been battling cancer. This past year has been trying for so many others, and our hearts are with those that have experienced hardships. I want to offer my sincere appreciation to the Governor Polis and the state of Colorado for their efforts in efficiently and equitably distributing the vaccine so we can protect ourselves and each other, and ultimately find our way through this tunnel and towards the light. Each night before bed, my son sends out loveness, as he likes to call it, and kindness into the world. Sometimes it's to a specific person, and sometimes simply to someone who needs it most. In the spirit of sending loveness and kindness into the world, in recognition of the privilege I carry, and with acknowledgement of those facing daily unimaginable battles, I will plan to donate a portion of these winnings to worthy causes that promote love, compassion, tolerance, and that simply perpetuate goodness. As I believe these to be the core values that we hold in solidarity as Americans and as human beings. From the bottom of my heart, I thank you.
Yay, Stephanie! And a million congratulations to you. And, I too had to experience over a year without seeing my parents. I know how hard that is. And many Coloradans did, many Americans did, because the last thing any of us would have wanted to do is jeopardize the lives of our own parents who we want with us for many years to come so that they can proudly enjoy their grandkids and grow old with us. For more information on the final drawing, you can visit coloradocomebackcash.com. We have 10 more $50,000 winners for 12 to 17-year-olds, one more $1 million winner for 18 and up here in Colorado. And we're getting very close to reaching 70% of Coloradans 18 and up with their first vaccine by Americans' birthday. By America's birthday, July 4th. It's also my daughter's birthday, July 4th. That was great because I was able to promise her a fireworks show every year, although last year we weren't able to deliver because a lot of them were canceled, but every year going forward, she'll get to enjoy that. And it's a great cause for celebration. The vaccine is quick, safe, effective. It's super easy to get. And of course, if you get it today, you can have automatic entry into our final drawing and the last chance to win $1 million. And you can tune in July 7th to see who Colorado's final comeback cash winner is. It's so easy to get vaccinated, and we kind of take this for granted as Americans, but like in many countries, there's huge lines and huge waits, and it's only a few percent of the population. But here, you can get it at your local grocery store, at pharmacy, pop-up clinic, at civic events like Denver's Pride event this weekend, mobile clinics, your doctor's office, the hospital, community health clinics, drive-through, you name it. To find out where the big blue buses, the mobile vaccine clinics are going to be, you can visit mobilevax.us. To find a site near you, just go to cocovidvaccine.org or just call our 800 number, 877-CO-VAX-CO, 877-268-2926. You can do it same day. You can show up. It's super easy. I know we kind of take that for granted, but we should take advantage of that opportunity to get protected and end this terrible pandemic in Colorado. If the kids want to come back up, and Stephanie's also available, join us back up here. We'll be happy to take questions for the kids. If they feel like answering, they're welcome to. They certainly don't have to if they don't want to. Stephanie, who's joining us virtually from Pennsylvania, visiting her father, Harry, and of course, any of the the tough curveballs are welcome for me as well. So with that, we'll go to questions.
I always feel like a party pooper, so I apologize. Although I want to explore this bathroom thing and make this special.
We'll see.
Governor, you now have $4 million winners. None of them were vaccinated as a result of you announcing the contest.
Yeah.
And after the first vaccination award winner, we talked about whether or not you could prove that it actually improved vaccination rates than otherwise. What metric are you using to know if more people got vaccinated than if you hadn't done this contest? But you can't rewind
Sure.
and get rid of the cash announcement.
So, I think Marshall, I'm kind of a baseball guy. Baseball is, it's a game of inches. I mean, it's a timing difference of a fraction of a second, whether you're out or whether you're safe. It's a strategic decision, and that's the case with this. We have a lot of people vaccinated, and of course, the vast majority of them got vaccinated because they want to be protected, they wanted to be safe, and so I wouldn't be shocked if all the winners aren't from that broader category. This is designed to get a few percent more, okay, a few percent more. So, to be at 70 by July 4th instead of 67%. And it's certainly possible that one of the winners, it might have factored in the decision. I also want to highlight, it's not designed to change anybody's opinion. For those who are not, they're not going to get the vaccine, the chance to win $1 million or $50,000 is not going to get it. So who's it targeted for? It's targeted for those, and there's a lot of them. Our research shows it's between 10 and 20% of the population that plans to get it. They say, I'll probably get vaccinated. Not tomorrow, I work this week, I'm busy this weekend, I don't want to be sore the next day. They're putting it off. And so this is designed to say, make a plan now and get vaccinated. And absolutely, we can point to, we think it's had a several percentage point increase in where we would be. Now, no one can ever know that, Marshall, and people can look at other statistics because we don't have the control. What you can certainly look at as a control is the states that did it versus the states that didn't, and you'll find the states that did it have a higher vaccination rate. You also have to look at what the alternative use of the money was. Would this have been more effective just in more ads? I don't think so. I think it's probably, we're doing enough ads. I don't think more ads will drive the behavior. So there's more we're doing too. In addition to this piece, we're also looking at how we can do more around smaller incentives that are actionable at the time, $50 gift certificate, $100 gift certificate, ski pass, Parks and Wildlife pass. So we're doing all those kinds of things, and you'll see more of that also. And, it's intended to drive people who are busy Coloradans, and I totally get it. I mean, it's kind of, I've equated it to, I'm kind of averse. I should probably go to the dentist once or twice a year, and sometimes I put it off. Like I just am busy, and I'll be like once every 2 years. So some people who intend to get it are just putting it off. And we're saying, here's a reason. You can win $1 million. You can win $50,000. Absolutely on the margins. It can be the difference between out and safe, the difference of a fraction of a second, the difference of a few points. I hope that we have a winner that got vaccinated because of it. But again, most people are just doing the right thing to protect themselves. But yes, this will drive a few more percent to get it now rather than in September, rather than in October, to get them to make the concrete plan to get it done.
Hello, this is Meg Wingeter from the Denver Post. Can you hear me? Okay. My question is, we're still very wide disparity statewide in terms of areas with high vaccination, and a few counties still have, less than 20% of the eligible people vaccinated. So can you tell me a little bit more about what you're going to do in those areas? Because it seems like what we've been doing so far hasn't really moved the needle there.
So thank you, and we will provide you with, we have an updated chart, a very simple correlation chart that shows, it's no surprise, that the areas that have high vaccination rates have a very, 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 very low COVID rate. The areas with lower vaccination rates have a higher COVID rate, higher hospitalization rate. It's just good to see visually. We have that for the top 10 or top 15 counties, and it's a very linear correlation with a statistically relevant correlation coefficient. It really breaks my heart that people are getting COVID, being hospitalized, and dying in Colorado when it's a preventable disease. It was tragic enough. Early on, it was chaotic. People could get it, and some didn't make it. But there was little we could do about it besides take precautions in our own daily lives. Now there's a very simple tool to end the pandemic and protect yourself, and I hope that more Coloradans use it. I was in Mesa County last week, one of the highest COVID infection rates, not just in our state, but in the country right now. And we also had our state epidemiologist, Dr. Rachel Herlihy in Mesa County. We met with responsible civic leaders in Mesa County. They're very engaged, doing what they can to increase the vaccination rate. Also, CDC visited Mesa County. It's one of the, I think there's a confluence of two reasons that it has such a high rate. One is one of the lowest rates of vaccination in the state of Colorado. I believe it's around 44%. The second is the Delta variant is prevalent there. It's more prevalent. There's a higher percentage there than most places in the country as well. So CDC is engaged. I'm personally engaged. I was there. The civic leaders of Mesa County are engaged. I would also say that we're able to really witness that light at the end of the tunnel because we see the very low rates in Denver, Boulder areas where we have high vaccination rates and all but no transmission of the virus. I mean, the amazing thing is that we know the vaccine works on an individual level, but we're really seeing it work at a population level in areas where we're at 70, 75, 80% vaccination rates. It's not eradicated, it never will be, but the rates of transmission are very, 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 very low. And each person is giving it to less than one other person because of the high immunity. So it withers out and dies even when it's brought into the community versus, unfortunately, in areas of our state that are into 40 to 50% range, which is simply not high enough to achieve herd immunity. We have a mobile vaccine station detailed exclusively to Mesa County. I was there to kick that off last week with the Cattlemen Association in the parking lot of the Doubletree Hotel. And we're engaged with civic leaders in the business community in Mesa County and other areas of the state to try to not only make sure we achieve our statewide goal by July 4th, which I'm confident we will, but that we also work particularly hard for some of those counties that unfortunately have a lower vaccination rate.
Can you tell me, Stephanie, any more stories about how this has affected you or your family personally? Maybe some stories from your husband who works more closely with COVID patients than I think anyone else who has won this $1 million prize so far. I'd love to hear a story about how difficult it was for you or how you were afraid of the virus or anything like that. It would be wonderful. From Stephanie or Craig.
Oh, I could say it. Stephanie, he wanted to hear from you and and particularly also your husband. Any stories about being on the front lines of the virus? Maybe as your husband was a nurse at Fitzsimmons, and did he see what was it like in those early days with the patients? How it affected your practice as well as a psychologist? It must have been very difficult to adapt. Kind of how did you guys deal professionally with, since you're both healthcare workers, with kind of the pandemic and the virus and all those protocols this last year?
I would say that it's the year of change for sure for both Craig and I. In terms of Craig, yes, for sure, he had some really challenging patients that he would talk about. Just the nature of the heaviness of it all. I think what was really troubling for lots of patients were having to be separated from their family members and not being supported in that physical sort of way like most ICU patients might have access to. And seeing so many people on ventilators, it was really a challenging experience. But I think Craig's background as a sergeant in the Army came in handy, being a veteran, just really knowing how to rise up in those situations and handle really difficult things. Craig has he's very even keeled. So he just really excels in those situations. So in my mind, I'm a little partial, but I feel like they couldn't have had a better nurse in those situations. And then as far as it went for me, of course, the mental health impact was very prevalent. And working with individuals that have various rehab conditions primarily, and or even in my other role where I'm testing kiddos to see what's going on with their learning. For example, parents were having this moment to watch their kiddos on screen, on Zoom, on these other platforms, working hard in school, and some parents saying, something's going on here. So I saw a little bit of a difference in terms of some of the patients that came through the private practice, but but also, that mental health toll was really prevalent. And so my hope is that this will bring it to light and in some ways normalize the fact that things like anxiety and depression are things that people experience. It's just a human experience. And that when times are really difficult, those experiences can happen and those emotions come up. And then by doing so, I hope that we can talk about it more. I hope that we can find some great solutions to support people better in that way. And so in some ways, my hope is that this pandemic allowed for a bit of a silver lining in the conversations we're going to have around mental health.
Thank you, Stephanie, and a special thanks to Craig. Which one's Craig? Do I see him back there?
Craig is working at the VA today, so I'm hoping.
Oh my goodness! And it's here in these some of you who are joining us today. I mean, we would talk about ventilators here. We'd say we have this many, we need this many, we're trying to get them, we have them, but it's very different when Craig was with the patients on the ventilators. And as you know, a lot of them didn't make it. Some did. We still have many Coloradans on vents. It's very different for us to just talk about it, make sure we had enough. We did have enough, as you know, in our state, and we managed that. But just I can only imagine what he went through, seeing them deployed in the field and sometimes working and sometimes you didn't. And I know he helped save some lives. So we express our gratitude to Craig and to you, Stephanie. Thank you.
Thank you.
Is there another phone one? Okay. Well, let's give our students another round of applause. Congratulations. No hardballs for any of you. And thank you all for joining us. Thank you, Clara. Really good to see you.